Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with the weekly podcast, The Common Sense MD. Today I'm going to talk about something kind of unique. Um, let's talk about nicotine, that dreaded substance that's been linked to tobacco for many, many years. Um, but like Paul Harvey said, there's another part of the story to nicotine. So the reason I wanted to do a podcast on this is because I found out that for those patients that had COVID-19 and they still had no taste or smell, um, if you give them or tell them to go get some nicotine gum and chew it, just low dose, 2 milligrams, 4 times a day, chew it for about 10 minutes and spit it out, about half of them or over half will get their taste and smell back pretty quickly. It didn't work every time, but I still tell people to use that. So I started thinking about nicotine because I'd always heard that it really enhanced cognition, the way you think. So when you do a deep dive on nicotine, it's really useful for a lot of things. So let's do a little deeper dive on that. Um, it may help prevent Alzheimer's disease. It definitely helps treat Parkinson's disease. Unfortunately, nicotine has been doomed because of its association with smoking. It's the most famous part of tobacco, which links it to all the harms of smoking: heart disease, emphysema, cancer. In fact, nicotine is the only thing in that tobacco that doesn't cause these diseases. In reality, it has many benefits, especially when you talk about neurodegenerative diseases. It's actually good for the brain. How this works is it binds to acetylcholine receptors in your brain. It stimulates the cholinergic system in your body. Now, this neurotransmitter called acetylcholine controls muscle contraction. It works with the immune system. It regulates inflammation and stimulates other neurotransmitters like serotonin, epinephrine, norepinephrine, and most importantly, dopamine, that reward hormone or neurotransmitter that we talk about all the time. And that's why it's so addictive, especially when smoked. You know, when you smoke, that nicotine hits your brain in about 8 seconds. So it makes you want more. I never could figure out why people wanted to smoke, put that stuff in their lungs. But it's definitely because of the nicotine. I mean, they know they're gumming their lungs up and causing all kinds of problems. I mean, I've always had patients that see me as a doctor, and they're overweight. They have all these other problems, and sometimes they can be very nitpicky about their hormone levels and stuff like that. And then I'll look up and they're smoking 2 packs of cigarettes a day, and I can't figure out why. I often tell them, if you continue to smoke, this other stuff doesn't matter at all. There's nothing you can do to help your health if you're smoking, which is true. Smoking is definitely the worst thing you could ever do for your health, and I'm certainly not advocating smoking or dipping snuff. That's for the nicotine too, but that causes cancer, oral cancers, and also ruins your teeth. It stinks, so just like cigarette smoking. So I'm definitely totally against any of that. But what's interesting is the nicotine in there, how it may be good for you. But anyway, so dopamine helps people focus. It relaxes them. It delivers pleasure. And dopamine does other things too. It helps Parkinson's disease. Remember, Parkinson's disease is a disease of dopamine depletion. In fact, smokers have a lot less incidence of Parkinson's disease, probably because of that nicotine. There's no other reason. So nicotine is a neuroprotective. Some researchers believe it's the most reliable cognitive enhancer that we have. Studies from the Vanderbilt Center for Cognitive Medicine found that it's as effective as Ritalin for ADHD. Think about that. It also helps you burn fat. That's one reason why when people quit smoking, they gain weight. It activates thermogenesis. So it's not just that they need something to do with their hands. Nicotine activates thermogenesis, burning of fat. Nicotine helps your short-term memory. It helps your reaction time and can actually improve athletic performance. That's why you see a lot of athletes using snuff because it's legal. It also helps people with schizophrenia. Many patients with schizophrenia smoke because it helps them. The researchers at Vanderbilt feel that it delays or may prevent mild cognitive impairment, MCI, from developing into Alzheimer's disease. Think about that. There's a lot of studies going on right now with that. If you look it up, nicotine as a drug class is a stimulant. It causes decreased appetite, heightened mood, but increased heart rate and blood pressure. It helps your memory. It helps your alertness. It can cause side effects like nausea, diarrhea, headaches, sleep problems. It can also be anti-estrogenic. You know, we do so many hormones, work with hormones. Estrogen, good for women, not so good for men. Both need the right levels. And it's different for men and women. So for men, it almost acts like an aromatase inhibitor. It may help your testosterone from turning into estrogen. Of course, I hate smoking. Gums and patches are definitely less addictive if you decide you want to try this for some reason. And you definitely need to try it if you're smoking. Get off of it. Get off the smoking. The patches are my favorite. They have a longer half-life. But like I say, you may try the gum for getting your taste and smell back if you have long COVID. So you need to weigh the risk versus the benefit of this stimulant called nicotine. If you use the gum, start at 2 milligrams. If you use the patches come in, I think, 24 milligrams. You can even quarter the patches. You put it on in the morning, and if it causes you a sleep problem, take it off at night. But it's definitely helpful for smoke cessation, no doubt about that. Another thing about it is, as crazy as it sounds, nicotine in smokers especially may inhibit the penetration and spread of COVID-19 and have a prophylactic effect for COVID-19. Now, that's not to say you should smoke to prevent COVID-19. That's not what I'm saying. Definitely people with terrible lung function, which you will get from smoking, do much worse and have severe cases of COVID-19, which is a lung disease of inflammation. So, but it's kind of interesting that there was less hospitalizations in smokers than there was non-smokers. Isn't that really interesting? I hope you enjoyed this little talk about nicotine, because I think we need to study it. You need to weigh the risks versus the benefits. If you're a smoker, definitely try the gum or patch to quit smoking, because smoking, like I said before, is the worst possible thing you can do for your health. Then the next worst thing is probably being obese and inactive. So nicotine, not all bad, may be good, but don't smoke it. I hope to see you next week. Thank you.